Uterine fibroid removal, one of the most prevalent surgeries, is witnessing a revolutionary transformation. If you or someone you know has faced a fibroid diagnosis, there's promising news on the horizon. Join Leah Cooper as she unravels this cutting edge solution in this week's special segment of Lifestyles with Leah.
80% of women have experienced issues with fibroids at some point in their lives. This, according to Family Medicine Center's interventional radiologist, Dr. Higgins. Now, fibroids are non cancerous tumors that occur within the uterus, and their symptoms manifest in a number of ways.
They present very often with heavy menstrual bleeding. And other issues related to the bleeding, the blood loss, the loss of sort of oxygenated blood, resulting in sort of symptomatic anemia. And if you think about sort of the causes and sort of symptomatic anemia, fibroids for women is sort of really on top of the list. And what that provokes in many women is symptoms like lightheadedness, symptoms like fainting. Some women and many women actually suffer from fatigue and low energy.
Higgins also mentions that fibroids may affect intercourse as well.
The third category would be having painful intercourse, okay? That is a symptom that, of course, is not just an issue for the woman, it's an issue for, obviously, that's affecting her relationship with her partner, which may obviously constrain intimacy, which is a particularly troubling issue for women. The other thing is obviously something that's related to cosmesis, feeling bloated, all right? If you imagine sort of walking on a carpet and there's stones underneath that carpet, it's going to be really hard to sort of walk and navigate over that carpet. So imagine if those stones are sort of fibroids underneath the skin, underneath the abdomen. And so you may be going to the gym and really working hard, but you're seeing the benefits in your arms and your legs, but you're not seeing it in your tummy because it's not your abs that need to be tightened up. It's the fact that these fibroids are actually pushing out and making it look as if you actually may have like a full sort of abdomen.
And miscarriages are also classified as a symptom.
When you have a baby that's sort of conceived, one of the most important things that allows a baby to sort of kind of grow during pregnancy is a sort of unimpeded, sort of free, spacious womb. And so if there are big, heavy structures pushing on the embryo as the embryo tries to develop, then of course you would imagine that's not going to be a sustainable journey for the embryo. And so many women see me because of miscarriages.
Now, usually one would have to undergo surgery to remove them, but gone are the days of lengthy and invasive surgeries for fibroid treatment.
What we're doing at Family Medicine Center is really introducing a new minimally invasive therapy where there's not a 6 to 8 week recovery, there's not sort of scarring, there are no sort of risks to the uterus. You get to keep your uterus and you get to keep certainly your fertility. And these are solutions that we offer now that previously were not sort of accessible in the Bahamas. Certainly women in the past have accessed them, leaving the Bahamas to go to the US for many, many years. But these are solutions that sort of we are offering now so that women have another option to consider.
Shagira Popo tells us she had the procedure 2 years ago.
Well, I noticed I started to, my menstrual, it became heavier than normal. And during my annual right at Family Medicine, they discovered that I had a fibroid the size of a 3-month fetus. And it was really, the pain was unbearable. I never used to have the pains before. And initially I was like, okay, let me see how best I can live with this, find medication, but nothing was alleviating the pain. So when my mother told me about, the news was on and Dr. Higgins was on, he was talking about this procedure, I came the next day. And I spoke with Dr. Higgins, him and his team. They walked me through what's going to happen, and we had the procedure in December 2021. And I like I said to him, I didn't even know he touched me, only because I know I woke up in the hospital, but it was wonderful.
And this procedure is only available at the Family Medicine Center. Leah Cooper, Eyewitness News.